Hello, everyone. I'm Iris. My major is biochemistry and my faculty mentor is Dr. Ann Cheney.
Hello, everyone. I am Jacqueline. My major is I'm a fourth year biology major and my faculty mentor is Dr. Ann.
The title of our presentation is a cross-sectional analysis of dermatological conditions by occupational and environmental exposures among Eastern Coachella Valley agricultural workers. Thank you, everyone, for joining us today. I'll start us off by going over the table of contents. Our presentation will cover the introduction, hypothesis, methodology, research outcomes, conclusion, acknowledgements, and questions.
Next, I'll be going over the introduction. This research is a cross-sectional study within the Eastern Coachella Valley. Our primary focus is on Latinx farm worker immigrants living in Oasis Mobile Home Park in Thermal, California. We are particularly focused on this community as many agricultural workers are exposed to sun and arsenic occupational and environmental exposures. In addition, these agricultural workers within the region face challenges accessing dermatological care. The images shown are residents from Oasis Mobile Home Park. Moving on to the limited access to dermatological care, the first barrier is poor health insurance coverage. Many of the community members in Oasis Mobile Home Park are immigrants who do not have access to health care. Additionally, there is a language barrier. Many of these agricultural workers have the first language of Spanish or Purépecha. Purépecha is an indigenous dialect from a group of indigenous people centered from the northwestern region of Michoacán, Mexico. The last barrier is limited access to transportation. Many of the resources available are further away from Thermal, in larger cities such as Indio, which make it difficult for people to travel. I will now discuss the different types of cancers reported in Coachella Valley. Based on the 2019 Health Assessment and Research for Communities, members in this region report having skin cancer, breast cancer, prostate cancer, and other cancers. From these results, we can see that skin cancer is the most prevalent cancer in Coachella Valley, accounting for 35.4% weighted percentage of all diagnoses, or approximately 15,114 residents. Factors such as excess sun and arsenic exposure increase the risk for dermatological conditions, such as cutaneous, precancerous, or cancerous lesions. One of the main risk factors is occupational excess sun and arsenic exposure. Agricultural workers experience direct sun exposure during peak hours and handle arsenic-containing pesticides due to working in the fields all day. And these images are from workers in the Coachella Valley region. Moving on to the environmental arsenic exposure at Oasis Mobile Home Park. The water supply in this mobile home park was found to have almost 10 times the allowable limit of arsenic by the Environmental Protection Agency, also known as EPA. Many farm workers have taken up residence at the Oasis Mobile Home Park and report being uninformed about the substandard water quality. In these pictures shown from the residents of Oasis Mobile Home Park, they have reported the loss of hair and lesions on their skin due to poor water quality. The hypothesis for this research study is that agricultural workers residing in Oasis Mobile Home Park would experience occupational and environmental factors such as excessive sun and arsenic exposure, increasing susceptibility to cutaneous, precancerous, or cancerous lesions.
Next, I'll be covering methodology. During data collection, we will recruit 250 participants. Our eligibility criteria include participants needing or residing or working in the Eastern Coachella Valley. In addition, participants need to be 18 years of age or older. Lastly, participants need to be able to read, speak, and understand English or Spanish. During data collection, we will be obtaining participant consent. After receiving consent, participants will fill out an online-based questionnaire assisted by one of our trained student researchers weeks prior to the in-person skin exam event. After completing the online-based questionnaire, participants will then be given an appointment date to our 2-day in-person skin exam event in partnership with Coachella Valley Free Clinic, also known as CVFC in Mecca, Coachella Valley. During their appointment, participants will have a consultation with a dermatologist and a biopsy if needed. Next, our primary screening tool will be an online-based questionnaire, which includes validated questions from the Sun Exposure and Protection Index, also known as SEPI, which will focus on occupational sun exposure as well as sun-related knowledge and attitudes. Validated questions from 2 other questionnaires from the Hospital Costa del Sol Dermatology Services will help determine sun-related knowledge and attitudes. Our questionnaire will also include questions provided by the Division of Public Health Sciences from Wake Forest School of Medicine, which will help determine the participants' level of occupational sun exposure and occupational handling of agricultural chemicals and pesticides. Lastly, the UCR School of Medicine will provide questions to address the environmental exposures to EPA-identified arsenic-exposed residencies. When analyzing this questionnaire, below are some examples of the analysis for occupational sun and environmental arsenic exposures. The analysis of occupational sun exposure will be evaluated into 2 components using Sun Exposure and Protection Index, also known as SEPI. Part 1 of SEPI will be 8 questions, and the scores will range from 0 to 32 points. A high score reflects riskful sun behavior. Part 2 of SEPI contains 5 questions, and the scores will range from 0 to 20 points. A high score reflects a low propensity to increase sun protection. As for the environmental arsenic exposures, they will be ranked as high risk, moderate or low risk, and no relative risk. These categories will be dependent on the number of yes answers that are selected from the questionnaire. As for the skin biopsies, the dermatologist will first identify and document dermatological findings on the Qualtrics skin exam screening form. Next, the physician will perform a biopsy if needed and give presumptive findings until the biopsy results are analyzed and validated. Next, for our expected results, we expect our results to demonstrate a greater risk of dermatological conditions, such as developing cutaneous precancerous or cancerous lesions based off of the total body skin exam. Second, we also expect high scores for risky occupational sun behavior and a low propensity to increase sun protection, indicated by the results of the online-based questionnaire. We also expect a high risk for excess occupational and environmental arsenic exposure, indicated by the online-based questionnaire. As for research outcomes, primarily, we expect our research to determine and prevent the prevalence of socioeconomic factors that affect dermatological conditions in individuals who live in the Eastern Coachella Valley. Secondly, information collected during our research will be used to create plans to address any risky occupational sun behaviors and low propensity to increase sun protection attitudes. Lastly, information will also be used to improve excess occupational and environmental arsenic exposure for populations in the Eastern Coachella Valley.
In conclusion, conducting a cross-sectional study will assess the prevalence of dermatological diseases in the Eastern Coachella Valley of agricultural laborers living in an EPA-identified arsenic-exposed residency. Our research outcomes also focus on identifying the socio-environmental factors contributing to excessive sun and arsenic exposure, and sun safety knowledge and attitudes. Finally, given the rising hazards faced by this vulnerable population, the study is of significant importance and can help mobilize efforts to address their dermatological needs.
Next, we will be introducing our acknowledgements. So a special thank you to the team members that made this presentation possible. I'd like to thank Jacqueline, Dr. Chenny, Stephanie, and Roy. We would also like to thank our other collaborators. Thank you, Dr. Oswald, Dr. Linden, Dr. Kelame, Tatiana, Michael, and Marcia, as well as the UCR School of Medicine, the Dean's Research Innovation Grant, and the Coachella Valley Free Clinic. We would also like to acknowledge our references. Also, if you'd like to contact us, please scan the QR code. If you are interested in filling out our interest form to volunteer for our cause. Thank you for your time. We will now be taking questions.